Are you suffering with lower back pain when squatting? Hi, I'm Dr. Gray. I'm the owner and founder of Back in Motion Fitness and Performance. I'm a physical therapist and I'm also a sports performance coach. I'm here with Coach Chad Anderson today, and so we're going to be talking about 3 different ways that you can prevent lower back pain when squatting. And so when you squat in the gym, obviously the squat is a movement pattern that's been around for hundreds of years, and we need to squat, but it should never be painful, right? And so there's 3 main reasons why the majority of people will get back pain when squatting. So the first one is they're going in what we call a butt wink position. And so Coach Chad here is going to do a squat for me. And as you see here how, go back up Chad, let's just go ahead and do repetitions. As he squats, how his pelvis tilts underneath. And so basically what is happening, his spine is going into flexion. But when we squat, we have an axial load on it. So we're actually causing flexion with axial load, and our spines just don't like that. It's hard on the discs, it's hard on the ligaments and that. So we really want to hone in and figure out the best position for him. So the way we do that is, Chad, if you go in quadruped for me? And what we're gonna do is play around with their different foot and hip positions. And so when you go in this quadruped position and you rock back, this is the same position as a squat. So we're just going to tweak his foot stance a little bit to see if it changes when he can, or when he does a butt wink. So Chad, go a little bit wider with your legs now. And yeah, now go ahead and go back. And you can see he kind of almost butt winks sooner. So we want to bring his feet in a little bit more. And then now go ahead, Chad. And he, maybe a little bit less there. So let's go ahead and go a little bit back wider again. And then go ahead and go back. So right there. So that's the stance we want to potentially get Chad in with his squatting position. So he's just maybe about 2 feet wide with his femurs, but his feet are maybe about a foot apart. So Chad, go ahead now. Let's stand back up. And so kind of assume that kind of same distance, and then squat. Right. So he's at his barrier there, so with him, we wouldn't want to go deeper than that, right? And so obviously from a rehabilitation standpoint, there's different things we can do to help maybe change that, but we want to avoid the butt wink, okay? The second reason why people get lower back pain when squatting is because they're asymmetrical when they're squatting. So a lot of times they're either weak on one glute, they have reduced hip flexibility or ankle dorsiflexion flexibility. And so when someone has got reduced motion, this is what it looks like from the back. Go ahead. So Chad, act as if your right ankle is stiff and you're going to lean more to the left when you squat. So typically when someone lacks mobility, they'll shift over to one side or the other, okay? And so in this case, if he shifts over to the left, that means he's got adequate flexibility in his hip and his ankle, but he doesn't have it on his right hip or right ankle. And so the way we can clean that up is testing what it is, first off. So a quick and easy way we do a testing is, Chad, I want you to just hold my hands and shoot your knees forward. Let's face the camera here. And so this is an ankle dorsiflexion test. And so we want to basically see the excursion of the knees over the toes. And if they can do that without their heels coming up, then we know they have pretty good dorsiflexion, right? We can also do the same test and weed out one by one. So he's going to put one leg forward over the other. He's just going to drive this knee forward. And I want to look at, again, the mobility of his ankle, in which you can see he's getting a lot of excursion. So a lot of times athletes and clients, if they're tight in the ankle, they'll go here and they'll stop. And that's the only mobility that they have. So a lot of times it could be the calf or it could even be the joint. So if it's the calf, you can do different corrective exercises such as, foam rolling of the calf. You can even do different stretches such as the downward dog to clean that up. Now if it's the hip, this is the way we weed that out. So Chad, go ahead and go on your back for me. So when we squat, the hip goes into hip flexion, adduction, and internal rotation as we bend down. And so we just want to, just check the difference in asymmetry between right and left hips. And he actually has a little bit more mobility in his left hip compared to his right. So, he may actually shift a little bit. But another way we can do is check the hip internal rotation and coming in here like this and seeing what their mobility is compared to the other side, right? And so if the hip internal rotation is tight, there's a couple things that could be limiting it. It could be the hip external rotators are tight. It could also be the joint capsule. It also could be other pathologies of a labrum, or they're structurally, that's the way their hip was built. So those are things we want to change potentially, right? So if it was just muscular and a tight hip joint capsule, you could stretch out the muscles in the hip joint by having him just work on going into some internal rotation of both hips. Okay, so that's a good way to mobilize his hip. We also could potentially put a band here and pull out on the hip joint, and then he can rotate back and forth in and out to mobilize that into internal rotation. But needless to say, lack of ankle flexibility and hip internal rotation or hip flexion will cause you a shift of the pelvis when squatting, and that can put a lot of torque on the spine. And so then another thing that we commonly see is weakness of potentially the glutes or the quads. And so there's different compensations for each. So you will potentially see a hip shift when someone has a weak glute. So if I have I'm deep into my squat, and as I come up, I'm again shifting, it also could be that weak glute. And so a way you can test that out is by doing a couple of tests called the single leg bridge. So Chad, go ahead and let's do a single leg bridge, and go ahead and bridge up. And so you basically want to load this up. So you want to have them do, till fatigue and see how many reps they can do on right versus left. And you're just looking for a major difference between right and left side. So he looks good there, so then we'll go ahead and we'll just test the left. Okay, and so that's all cleared out. So just assume if his left side was weak, right, he's going to lean more towards the right side, again, causing that shift, which can mimic a potential ankle dorsiflexion limitation or a hip mobility issue, but in reality, it could be the glute, okay? Now, the other issue that happens with people squatting, they get back pain, is they'll have weak quads. They can't stay relatively erect when they're squatting, so they lean forward more, and then they try to use their lower back in their hip extensors to extend instead of using their quads. They can't keep that relatively vertical posture, and so it's usually indicative of a weak quad. So a couple of tests that you can do is like a pistol squat, which biases that. So Chad, just hold my hands here, and go ahead and go in a single leg stance, and then come down and back up. And back to the left. And again, you're just looking for differences, left and right. And so if you see a big change, then you probably know you're barking up the right tree and that they may have some weakness of their quads. So there you have it. Those are 3 tips to a healthier back squat without pain. So we talked about avoiding the dreaded butt wink. So you want to check different foot positions to see if it changes it. We then talked about the lack of hip flexibility and ankle dorsiflexion flexibility. And then lastly, we talked about weakness of the glute on one side or the other. And then we also talked about weakness of the quadriceps that may cause compensations of the spine and overloading of the hip extensors and the back and pulling you into flexion. So there you have it.